Okay, so thank you so much for staying with us till the very end. It's been a very knowledgeable day for us, especially in the afternoon. So learning a lot about compulsory licensing and more patents. So as we have mentioned today morning, we'll try to leave the opportunity for the audience to ask more questions, any questions related to today's morning or PM session. And we will, without further ado, start with the first question. Yeah, Ms. Jack.
I think this whole day's workshop has been very informative and giving us the a lot of these principles and what is happening on the patent control and things like that. I used to work in the public hospital system, so I'm fully aware of how the drug mechanisms and works, and also I served in the pharmacy and poisons board for 6 years. So I know how the drugs are evaluated and also granted the registration status, and how are they being manufactured locally, being granted the local manufacturing license and all those stuff. But you feel me and the gap about the background and what is happening internationally. But since this afternoon's topic is a better future for access to medicine in Hong Kong and beyond, so I wanted to raise, it's not a question, but I wanted to raise the audience awareness about two things. First is, of course, we wanted drugs which have been innovatively manufactured and patented and to be accessible to the population, all right? We wanted that, cheap, affordable drugs to be accessible. So, but we also need to let them have this patent. Otherwise, nobody would do this R&D. But then, once this patent is off, we should encourage more people to manufacture it. So in Hong Kong, we have local manufacturers doing the generic manufacturing. But as I speak to them, because I'm one of the board members, so they come and tell me their problems. They think that we can help them, but actually we can't. What a shame. But we really can't, because they say that when they wanted to manufacture those generics, they could not import the ingredients. They could not import, especially the latest, newest, and generic form of those patent drugs. They could not import it, not because nobody wants to sell it, but because the law in Hong Kong somehow makes it very difficult for them to be imported into Hong Kong. I do not know how this problem is being dealt with elsewhere, but they find that, for example, if it is a very new, just off-patent drug, they want to manufacture it in Hong Kong. They find that they cannot get access to those raw materials. I do not know how India managed to almost do generic on everything. I do not know how that process is being facilitated. This is one question. Yes. The active ingredient of that patent product. I do not know how it is being dealt with, because it is not a product as such already. Yeah. So the Pharmacy and Poisons Board do not deal with it, because, it's the raw material. Yeah. So this is one question, which really limits the growth of the local industry on making more generic forms of drugs. And this will also become a barrier to better access to more drugs, And it is not only protecting making more generics available, it is also how to facilitate the process to make it easier for those people who really spend the money to build the plant, to put in all the processes, but they find it very difficult.
So a new question on actually importing the active ingredient itself. Any thoughts on that?
No. Well, I don't, because I don't know. I mean, it's not a customs issue. It won't be. It's just they can't get a supplier, I guess. I would love to speak to them to see exactly what their problem is, but it doesn't sound like it's a regulatory hurdle at all. So I just. How is it a regulatory hurdle? I just don't see it. I don't see how it can be, but. I'm not sure. It wouldn't be any IP. I don't know. But I'd love to chat with you later. Yeah. But I would love
New
to
research
specifically
question.
know the problem. Yeah. I mean, I know that. Look, when in the past few years, in writing that book and doing that research, I talked to a lot of branded pharmaceutical manufacturers and a lot of the big generics, and to say, why aren't you here? Why do you just have your marketing arm here? Why don't you produce here? And now that issue was just cost, basically. It was twofold. It was mainly cost. Essentially, when we set up a plant, we go around and say, what are you going to give us? And other places give us tax breaks, they give us da-da-da. You guys say, maybe we'll give you some cheap land at the science park, right? So we don't go. And so they say basically Hong Kong's not competitive, and also because it's expensive. The other thing is because a lot of our, manufacturing, getting the GMP, if they have to buy land and build a building all by themselves so they can control everything in that building, it then becomes cost again, right? The existing factories and that they don't really trust, they would have to buy everyone else out, so it comes back to cost. So that's why I think the large scale aren't here. But as to that problem, I'd love to chat later on and then be put in contact with them to see what actually hurdle they're talking about.
Great, we've got a new connection. Any other questions from the audience? Yes.
It's a great talk this morning and this afternoon, but I've repeatedly hear two things. Looping around is first is about we try to lower the cost. And the second, of course, finally, is whether the drug is accessible. First, about the cost, I think we put many stress about the patent, about the licensing, that kind of some internationally recognized difficulty to get the drug into the market. In Hong Kong, I think the context is because 90% of the patient is in the public system. And the public system indeed is very low cost, but for most of the drugs, I would say. And now the government also look into the cancer drug, try to make it more available in terms of different kind of cancer drugs, and also have a program about the self-finance drugs. All this is trying to increase the accessibility. But I would take the context of Hong Kong is because of this big system in the public system that control the drug use, I would say. But do you think we should take more perspective is from the patient right, that they have a choice? And also how to have a better evidence-based control, that kind of the perspective. Because finally it's a market. But now seems in Hong Kong we monopolize most of the drug is because of the government take up a lot of the responsibility. But I don't know whether it's healthy or not. And on the other hand is we say the cost is low, but the cost is low, does it equal to is affordable? Because what I mean is another perspective we look at is about the value cost. Is Panadol low value? But why Panadol was always being raised in Hong Kong? I think this is another perspective about the health behavior, the culture. And the third is a lot of middle class indeed is suffer rather than the lower social class in Hong Kong related to drug. It's because of the special phenomenon or the system in Hong Kong is almost the most lower social class, they get almost free for any drug. But for middle class, sometimes you have indeed to pay more in terms of the present situation. And we don't have a very good insurance system related to that. And the insurance related to health is only developed, I think, for what I mean is significantly over the last 5 years. And so that means that Hong Kong is really a special area to follow, to study, but it seems that we don't have many perspective to link up the cost with the patient journey and different kind of category of patient in Hong Kong, especially in our small group discussion this morning. For the private market and the public market, the GDP is the same. But the patient that was being taken care of in the public market is 90% of the patient for the whole territory. And also now we know that there is no data or no figure related to the pharmaceutical GDP. And so a lot of things is not transparent. And when we can see the same drugs with a so wide range of price in the market, that means that it's not transparent. If it is transparent, then the people can choose. The people will know where to get what they think they affordable. So I think there are a lot of things can be done in Hong Kong to make the so-called, are we really accessible to medicine? Or we just used to get low cost of drug from the government in the public system. But indeed, is that means we have a choice or we really accessible to so-called the wise use or meaningful use of drug and not to have seeing so many drugs being raised, not being used, and that is the taxpayer who pay for it. It's not healthy in the long run in this kind of a system. I just try to link up everything in my perspective as a doctor in the public system, because we have so great speaker here. Just try to have a more understanding and discussion further on.